Hey, are you currently working out? And have you ever hurt yourself? Have you ever like hurt your back and been like, oh, this part of my back hurts? Or, oh my gosh, my knee hurts, which can, of course, happen whether you're working out regularly or not. But let's talk a minute about mobility and flexibility. Sometimes you get out of bed and you're just like, oh my gosh, I'm so stiff. As we get older, you guys, our mobility decreases. And if you're not stretching regularly, it's never going to get better. In fact, I can guarantee it's going to get worse. Then, if you can check your mobility, you guys, on the ground, I have clients tell me this all the time, who can't flex in their hips, who can't relax their hamstrings, who can't get their feet up in the air, and who are fighting a lot of tightness. Then if you're working out and you're really tight and you have a little tweak, you like have a small little injury, this can go a couple of different directions. What I see happen a lot of times, and what frustrates me a little bit, is people just stop moving and they don't address the soft tissue injuries or the soft tissue imbalances that are always linked to being inflexible. So I find a lot of people say, I'm really tight, but then I say, are you stretching? Are you having anybody passively stretch you? And generally the answers are no, no. So what happens, let's talk about if you get a little injury at the gym or in life, and you get what I call a twinge. We're not talking about a skiing accident. We're not talking about falling off a sidewalk and, spraining your ankle. I'm talking about doing something and when you go, oh, that kind of hurt. We're usually not dealing with serious injuries. Let's start with that. 9 out of 10 little twinges don't require surgery, right? Most of the time, it's soft tissue injuries. So you can go one of two ways with this. You can just stop doing everything. Not going to do anything anymore because I hurt myself. Then, as this is going to progressively get worse because you're not doing anything about it, you go see a doctor. Fine, go to a doctor if you have any questions about what's going on with you. But generally, what's the doctor going to say? Stop. Stop what you're doing. And or go see a specialist. What's a specialist really good at? Injecting things or doing surgeries. And then guess what they say to you? Stop. So you have this whole path of like doing less, and not addressing the soft tissue injuries as compared to, especially if you're working with a trainer, see your trainer, ask for help, see a physical therapist, say, you know what, I'm really tight in my hips and I haven't done anything about it and I'm getting older and now I have this back pain. Let them stretch you and let them teach you stretches that you can do so that you get better. When we stretch you, you continue to get more mobile and you can keep moving because think of it this way, you guys, motion is lotion. The more you can move, the better your joints feel and work, and then the more stretching and mobility work you can do, the more imbalanced you're going to be, which takes the pressure off your joints, which allows them to heal and work optimally. So that's my tip for you guys today. If you have a small twinging injury, try to stretch it, learn how to do some stretches, or get passively stretched and have a professional teach you how to manage your soft tissue injuries. You should feel better instantly. Okay, you guys, that's it for me. I'm Maureen from Essential Fitness. Stay healthy out there.